Olá, meu nome é Sidney Klajner, eu sou cirurgião do aparelho digestivo, presidente aqui do Einstein e membro do Board de Diretores do Institute for Healthcare Improvement, o IHI. Nos últimos dias, o Einstein sediou a 9ª edição do Fórum Latino-Americano de Qualidade e Segurança na Saúde, o maior evento para debater o tema na região em parceria com o IHI. E este ano, o tema central foi Tecnologia para a Equidade. A discussão é muito relevante em todo o mundo, mas especialmente no nosso país e em toda a América Latina, onde as desigualdades econômicas e sociais impõem enormes desafios no acesso à saúde. A utilização dos avanços tecnológicos para superar essas barreiras e garantir atendimento de qualidade, independentemente da região, ela está no centro das ações do Einstein para transformar a saúde no Brasil. Durante o fórum, dialogamos com parceiros de diversos países sobre como podemos ampliar nossos esforços para promover em todo o mundo a equidade em saúde. E hoje, aqui comigo, está a Andrea Werner, diretora de Saúde Populacional do Emplify Health dos Estados Unidos, da região de Wisconsin, para falarmos sobre temas muito importantes quando a discussão é qualidade e segurança, saúde populacional, promoção e prevenção e sobre como a tecnologia é uma aliada para isso. Bem-vinda, Andrea. Welcome, Andrea.
Thank you, Sidney. Thank you so much.
Andrea, so this is the first question to talk. The forum hosted here at Einstein was a great space for discussion on how to promote more quality, safety in health. When we think about population health, that is looking at larger groups of people, how can we work to ensure health quality and safety for certain populations?
That's a great question, Sidney.
A great question.
It's a great question.
You have all the day to answer.
It's a great question. My mindset leading population health goes really to the community and to equity. So when I think about quality, safety in the context of the community and populations, I think about who are we leaving behind? Who do we have yet to serve? What is the data telling us in terms of results from one population that we're comparing to another population? So in population health, we think about community not really inside the walls, but my mind goes to quality and safety outside the walls. Too often in healthcare, we think about the patient didn't follow through with the immunization, or the patient didn't follow through with getting their medications. We think about why. We need to ask the question, why 5 times? And when we seek the answer to the why, we may learn that the mother didn't have transportation, that the mother has a partner in the home where she doesn't feel safe. And we need to seek to help resolve those problems in order to ultimately drive safety and quality for everyone. There's a beautiful intersection between quality and population health. Quality really thinks about things inside the walls of healthcare. Population health really exists to answer the questions about what is going on in the community. So for me, quality, safety, looking at larger populations, it's really about equity and looking at what we need to learn outside the walls in the community that's influencing the quality results and the safety of the people we serve.
So you must look deep in the population and what means for them
exactly
the values.
Exactly. In the United States, and I'm sure this is common in other places, it's a very patriarchal system of measurement. I think we need to go deeper and think through the eyes of those we serve and how they might rate their health, how they might define quality, how they might define safety. It's interesting because we're looking at a score, a community health score, that is a patient-reported outcome, a self-reported health status. And people can rate their health from fair, poor, good, better, excellent. We actually have about 86.5% of our population that rates themselves as good, better, or excellent health. And we're focusing with intention over 5 years to move that. At times, people will say to me, well, that's pretty good, like that 87%. And I have patients, this is like physicians will say, I have a patient sitting in front of me and they're almost dying, and they're not doing very well, and they'll still say their health is good. That's okay. That's how that person rates their health. And I think that's really important, and a big area of interest for us in the future is to go more upstream in our systems of measurement through the eyes of the patient and not through the eyes of our payers or the eyes of our government. Not that those things aren't important and we need to do those to be compliant with regulatory requirements, but to me, what's most important is upstream. I'm an upstreamist.
Agree at all. And it is an inspiration also. Andrea, health promotion and prevention are keywords when we talk about population health. And the focus on integrated care, which looks at the individual as a whole and follows their health trajectory, is a concern for ours here at Einstein too. But this is far from being a universal reality. What are, in your point of view, what are the obstacles for health promotion and prevention to be understood as fundamental pillars of healthcare by organization, by health professionals, and patients?
I am a huge believer of lifestyle medicine. And we have in the United States the American College of Lifestyle Medicine. There now is an international community as well. Here in Brazil, you have this too. Lifestyle medicine looks, again, upstream at the 6 pillars of health. So if we're going to be focused on health promotion, we need to focus on things beyond the clinical. We know that 80% of our health and well-being has nothing to do with what happens in the office. It has a lot to do with what happens in our homes, in our neighborhoods, in our communities. So lifestyle medicine looks at things like, how much do we move? What do we eat? How much do we sleep? What are our healthy relationships? What substances are we using? And things like that. So I think focusing with intention on taking care of that whole person and that 80% of the human experience that is outside of healthcare is really, really important. Now, there's barriers there. It's interesting. At Bellin, one of the regions in our Emplify Health, our newly merged organization, I think that it took me 10 years to infuse and invite and engage our system to believe that lifestyle medicine, was what we should do. 10 years. And there are a lot of reasons, I think, for that, because the way that healthcare is structured in the United States and in other places, it rewards procedures and things like that. It doesn't necessarily reward what's right. Yes. But we've found with lifestyle medicine that we can achieve significant results with our employees, with our patients. And so currently we're focusing on creating a platform across every county that we serve that will create access for lifestyle medicine, virtually, in person, at scale, because we believe so much that that's really the number one area of focus and way that we can ensure that we achieve that community health score, which is identifying health as good, better, or excellent instead of fair or poor. If we don't go upstream and think about lifestyle medicine, that will never happen. Another interesting thing about that is lifestyle medicine needs to not just be clinical, and only available in the clinical setting. I think we need to create creative partnerships in our communities. We're working right now with our local YMCAs. Those are organizations where heavy focus on physical activity and other things like that. But how might we educate the community and have them fall in love themselves with being healthy before we have to tell them they have to be healthy, and help them understand their personal why about prevention? Because it shouldn't be, you're obese, you have diabetes. It should be someone saying, I really want to be able to walk my daughter down the aisle when she gets married. And we can say, well, we can help you do that by going upstream and adjusting lifestyle. Lifestyle medicine is also so important because the number one way we can reduce the cost of care is to avoid disease to begin with.
And the most challenging thing, I think, because for the population or for the patient, it's easier to get a pill or a prescription than change lifestyle.
Yes. So let's talk about pharmacy with a PH, PHARMACY, and let's talk about pharmacy with an FARMACY. In my personal life, we have an organic farm,
Yes.
and we grow lots of vegetables, and we are trying to infuse into the community the connection between food as medicine. And there are so many children in our communities that have never seen a plant and never grown a plant and seen the fruit that can come and tasted the fruit and then understand
Yes.
that creates a healthy body, a healthy mind, and avoids disease.
I agree at all.
So
We have programs in Einstein to help professionals to go to nature and to be somehow for a while of time together with trees and nature and greens. It's very important.
I love that. I learned about that at a session I attended at the forum, and I was very impressed. I congratulated everybody.
The Andrea talk here is an inspiration to prevent disease, and this is I think the most challenging thing that we as leaders can do. So it's another challenge to leaders also to give this information and to engage people towards the changing lifestyle.
It is, and I think it's because it's very personal. You start talking about somebody about what they eat, it immediately gets very personal.
Yes.
Don't take away my churrasco. Don't take away my, And I don't think it's about taking away. It's about adding. It's about adding more of the things that lead to health. It's an and strategy.
Yes.
It's not an either or. It needs to be an and strategy.
So much has been studied about the impact of social determinants on health of populations, especially when we talk about chronic disease. Obviously, the definitive solution will involve political, economic, and social actions. But based on your experience, is it possible for health sector to somehow mitigate this impact? And if so, the $1 million question, how?
It is a $1 million question. It's interesting because we've been collecting social determinants of health data on our patients since 2021, and our employees. You can't leave the employees behind. You have to, treat your own family just like you treat the people that are your patients. So that data gives us insight into things that are common problems. And in our current way of thinking is that we can't just have interventions at the end to the degree of one human or at the community level. We have to move into the space of policy. We're fortunate at Emplify Health. We have a government affairs team, and they're just a wonderful partner to us in helping move things through. So I do believe that it will take local partnerships to influence policy, and then at the federal level as well. There's an incredible book that just came out recently called The Anxious Generation by Jonathan Haidt. And the data of what has happened to our children during the revolution when internet became accessible and when phones started to have cameras, it is unbelievable the negative impact it has had on the youth. And this book explains the data and the opportunities. An example of what you're talking about, Sidney, is that he suggests that we should consider policy around access to cell phones and limiting it prior to 8th grade, just things that we need to do at the policy level and really work towards. So one of the things that we'll be focusing on with intention is our youth and having them get back to play and social connection and away from their screens. And we can do that in partnership with schools, in partnership with community organizations, and we need to partner with the government and really think about how we can make that happen. Our Surgeon General, Vivek Murthy, recently went to Congress and requested that we have warning labels on social media, just like we do cigarettes. So the problem in the United States with this particular issue is huge, and in Europe and Australia and other countries as well, as the book would show you. But that's an example of how we need to collaborate with policy to help reduce these mental health, these illnesses, these concerns that are leading to high rates, painful rates of suicide in our youth.
Agree. This is a huge problem. And depends on the purpose of that, because there is many interests involved.
There is.
And in this topic, again, on social determinants, here at Einstein, we are working on a project we call D-Matter, which will develop a tool to analyze, based on public data from our public system patients, and with the help of AI, the influence of social determinants on the treatment of patients with type 2 diabetes, which affect 9.1% of the population in Brazil. This algorithm will link indicators from our public system on the clinical history of patients to their socioeconomic information. So it's very, very related, trying to discover. Will be possible to evaluate and improve public policies related to prevention and treatment, for example. And this mapping can even help to improve the management of public resources, all this with the use of artificial intelligence. How do you see the possibility of using technology, especially data and artificial intelligence, to ensure better health for population and greater equity in access, for example?
When you ask that question, my mind goes back again. It goes back to the community. It goes back to the environment. I would love it if when we have patients in front of us or people we're engaging with the electronic health record, that automatically in that record it would populate with conditions in the geography that that person resides. Imagine if you knew that the person in front of you lived in an area where the water wasn't safe, or where there was a higher risk of lead poisoning, or a deeper knowledge around the environment that automation allowed us to have insight to without anybody having to go out to look. I think that would be a really interesting example of how to apply that to populations.
So, Andrea, the last one that I'm making, at the 9th Latin American Forum here in Brazil, in Einstein, which took place this week, we talked about how to measure health improvement in the general population and other stakeholders, such as our employees. Why should this be a concern for organizations and companies around the world, including in countries with developing economies?
I'm smiling because my answer is lots of discussion around this. I think, as a healthcare organization, our organizational pronoun, our identity, is a population health organization. I believe that we exist in our communities to invite and engage and empower all people in leading their healthiest lives. That shift from only thinking about episodes of care to moving to putting your arms around a population and waking up every day thinking about what health and well-being looks like. When I think about investing for my retirement, as an example, and saving dollars so that I can retire, I think about investing in our communities, because if we don't invest in communities and as healthcare organizations be that anchor, that convener, when we retire, what kind of community will be there? What kind of community will our children and our grandchildren grow up in? So I feel very strongly that our role is to be a population health organization. Our role is to be an anchor, and our role is to be the organization in our community that really is responsible and accountable for the community. So I obviously feel very strongly about that, Sidney.
And this overpass the health issues, because it's a way of living, as you said, the changing lifestyle.
Exactly.
And also have better communities when we are getting old.
Right. Well, I mean, we owe it to the world. I mean, it's not even here in São Paulo or in Green Bay, Wisconsin.
Yes.
I mean, this is something that as healthcare leaders, we need to collaborate from a global perspective on how to think through the world. Climate change is a huge example. If we don't start to focus with intention on the impact, there's no argument around how climate will begin to influence the health and the lives of people. We need to be out front and we need to lead. We can't wait for other people to come and solve these problems for us. So I feel very much accountable. That's the word that I feel in healthcare. My job is to be responsible and accountable, and we owe that to our community. Doesn't mean we need to do all the work. partnerships are how we're going to get this done. Partnerships with industry, with community organizations, with the government, with each other. But we have a huge role as the anchor and one of the pillars to lead.
I love that. Inspiring. I think everyone that is listening to our conversation. And now I'm a new fan of the Packers, Wisconsin. I want to thank you for these conversations. Thank you for being with us at this week in the Fórum in Einstein. And I'm very, very pleased and very happy that we are changing information and moving forward to prevent disease and to population health. Thank you very much, Andrea.
Muito obrigada.
Agradeço, Andrea, então, por esse debate tão proveitoso. Agradeço também a você que nos acompanhou até aqui. Assista às demais conversas que nós gravamos durante a 9ª edição do Fórum Latino-Americano de Qualidade, Segurança na Saúde, na playlist dedicada ao tema aqui no canal do Einstein no YouTube. Um abraço a cada um de vocês.